Hi, I'm Dr. Arlen Meyers. I'm with MI10 and I'm the president and CEO of the Society of Physician Entrepreneurs. I thought it would be useful to discuss some of the issues and challenges confronting medical schools during these COVID times and what's going to happen post-COVID. So my view is that medical schools, like every other healthcare or sick care institution, has had to revisit their business model and how they do things, and medical schools are no exception. So I think these are the problems that medical school faculty and administrators are looking at. One is trying to demonstrate the value of medical education. And more and more, we're seeing surveys and indications that because of how medicine has changed, the issues that healthcare professionals are confronting during COVID, rising student debt, lifestyle issues, and other things, medical students or prospective medical students are beginning to question the value of a medical education. Now, that said, the numbers actually of applicants to medical schools has reached an all-time high. So I think we're going to see some shakeout as the future unfolds. The second is more and more medical students and pre-meds are interested in non-clinical careers, and this is an opportunity for medical schools to accommodate them. Third, medical schools are seeing a decline in their sources of revenue, and those are grants and contracts, clinical revenues, and for public schools, state support. A fourth is curriculum reform, because we're seeing more and more things that are becoming more and more important to the practice of medicine, not the least of which are issues concerning the business of medicine, system science, reimbursement, policy issues, big data, analytics, entrepreneurship, et cetera. The culture of medicine has also presented some challenges, because a lot of medical students are now seeing it as toxic, and everything from bullying to sexism to aging to physical assaults have to be remedied. There's a major push toward remedying the inequities in equity, diversity, and inclusion. The seventh is that the business model of medical education, that is high costs and loans, are contributing to doubts about pursuing medical education. It's leading to residency choices that may be dysfunctional and contribute to further geographic and specialty inequities. So those things, in addition, need to be addressed. We're looking at a sick care workforce shortage, at least one that is predicted, and we're going to have to rethink how we reskill certain individuals who are interested in pursuing sick care careers. And again, part of this is rethinking the business model to mitigate the lack of workforce development, particularly how we fund graduate medical education programs, which are a significant bottleneck. The ninth is we're pretty much stuck in a sick care system rather than a healthcare system. And in fact, we have a dysfunctional sick care system of systems. The United States presently spends $3.8 trillion and growing, and the vast majority of that money, over 95% of it, is actually spent on taking care of sick people. Well, in order to meet the almost infinite demand for care with finite resources, we're going to need to do more to focus on healthcare, disease prevention, and wellness, and that will require substantive policy change and re-education at the medical school level. And the 10th is that we need to train medical student graduates to win the fourth industrial revolution. And that means having data literacy. It means having an entrepreneurial mindset. It means understanding design thinking and more patient-centered and stakeholder problem solving. So all of these things are going to have to get the attention of medical educators and medical administrators, and the smart money on Wall Street and Main Street are betting on those who see these as opportunities rather than challenges and embrace the change rather than fall back into post or pre-COVID complacency. Thanks. This is Dr. Arlen Meyers, and thanks for your attention.